Simon, and I'm going to walk you through the healthcare systems found in Turkey versus the healthcare system found in the United States. I hope you enjoy. So to start off, I provided a map of the location of Turkey. If you're unfamiliar, it's very different than the location of the United States, thus prefacing the complete difference in culture and history of the two countries. So first of all, the type of healthcare system in place in both countries is very different. So Turkey implements a universal healthcare system as of recently. In 2003, Turkey's Ministry of Health introduced a 10-year health system reform called the Health Transformation Program. Under this system, all residents registered with the Social Security Institution can receive medical treatment free of charge, and all hospitals contracted with the Social Security Institution. This program planned to improve public health and provide health insurance for all citizens. When achieved, this would be called universal health care. As the system was introduced, health system improvements followed. These included the introduction of family medicine-centered primary care and expansion of hospitals. These efforts have increased health insurance coverage for even the poorest individuals in Turkey, which is a huge step for them. The satisfaction with the healthcare system also greatly increased. So this is very different than the healthcare found in the United States, as we do not have a single-payer system like they do. Americans are insured through both private and public health insurance options. Citizens pay monthly premiums for their insurance plans, and this helps with their medical care in the future as needed. The Affordable Care Act was enacted in the United States in 2010, and this acted to expand insurance coverage for all Americans and included Medicare and Medicaid. So Medicare and Medicaid are two different government options for healthcare. Medicaid is low-cost healthcare provided for those with low income, families, children, pregnant women, the elderly, and those with disabilities. Most services are paid for by the federal government within the states. Medicare is a federal health insurance provided for Americans over the age of 65. So the other option apart from Medicare and Medicaid is private insurance, typically granted through your employers. Private health insurance companies typically compete for business by attempting to offer the lowest prices for coverage, so Americans are faced with a lot of choices if trying to decide on a private health insurance company. Health coverage in the United States has a lot of different private options as well as these public sources, and this adds into the wide gap of insured rates across the United States. As a measure of population health, we're going to look at the infant mortality rates in these two countries. So as you can see, infant mortality is the death of an infant before his or her first birthday. In Turkey, infant mortality rate is about 1,080 deaths per 100,000 live births. 100,000 live births. In the United States, infant mortality is about 590 deaths per 100,000 live births. So it's about double in Turkey than it is in the United States, and this kind of gives you a picture of some of the big disparities between the two countries. So in regards to how much is spent on healthcare, the United States spends a remarkable amount more than Turkey. So as you can see, the United States spends about $9,535 US per capita per year on healthcare. And in Turkey, they only spend about $455 US per capita per year. So you can see over the past 15 years, the United States has drastically increased their spending, and Turkey has remained about the same. Our healthcare system can also be analyzed by the rate of emergency room usage. So in Turkey, there are about 185 emergency room visits per 1,000 of the population. And here in the United States, there's about 407 emergency room visits per 1,000 of the population. So this is also another huge difference, and this increasing usage in the emergency room in the United States contributes a lot to the high costs found here in the United States compared to those in Turkey. So both the US and Turkey have implemented tobacco control efforts, as the negative effects of tobacco have become more and more prevalent throughout the years. Turkey is one of the 15 countries worldwide with a heavy burden of tobacco-related ill health and is known as a high-burden tobacco use country. According to the WHO, 35.7% of men, 9.9% of women, and 25.4% of Turkey's total adult population smokes tobacco every day. The WHO started the Bloomberg Initiative in Turkey with expectations of strengthening tobacco control throughout the country by strengthening the country's capacity for tobacco control and running sustainable tobacco control programs that protect people from exposure to tobacco and tobacco smoke, and with the hopes of preventing a lot of premature deaths. So Turkey is the only country in the world as of 2015 to have accomplished all 6 Best Buy MPOWER measures for tobacco control, which is what was implemented by the Bloomberg Initiative. So these letters stand for M, monitoring, P, smoke-free policies, O, cessation programs, W, warnings, and E, advertising bans, and R, taxation. So this is a little different than the tobacco control efforts found here in the United States. So to start off with, the smoking rates are a bit different. Men, about 17.5% of men smoke in the United States and about 13.5% of women. So the overall adult population that smokes here in the United States is about 15.5%. So the United States has a long history of tobacco control and major milestones. I'll just touch on a few of them for you. In 1966, health warnings first appeared on tobacco packaging. So on like the cigarette cartons, you would see a warning telling you that smoking tobacco can cause negative health effects. In 1975, the Minnesota Clean Indoor Air Act went into effect. This was the first statewide law that required separate smoking areas in public places. Many states began to follow suit after that. So in 2010, Obama signed the ACA, which I talked about earlier. The law expanded tobacco cessation benefits and establishes the Prevention and Public Health Fund, which provides funds to prevent and reduce tobacco uses. In 2012, the CDC launches the first ever federal government paid media advertising campaign, which encouraged people to quit smoking by giving accounts from people who had smoked in the past and warning people of the negative effects that they could be getting themselves into by smoking. But right now, adult and youth tobacco smoking rates are at an all-time low in the United States, but unfortunately tobacco is still the #1 cause of preventable death and disease here. As a measure of the physical environment, we're going to look at some air quality facts about each country. So air pollution is becoming a progressively bigger problem in Turkey. Citizens all over the country are breathing in very harmful air every day. The WHO has attempted to set standard air quality concentrations to protect health, but the concentrations of toxic things in the air in Turkey are much higher than these standards. According to the Health and Environment Alliance, Turkey is becoming a country with one of the highest rates of premature death due to air pollution in Europe. In 2010, it's estimated that 28,924 people died prematurely due to ambient particulate matter and exposure to the ozone. 97.2% of the urban population is exposed to unhealthy levels of particulate matter. So a big part of this is that coal plants release a lot of this particulate matter into the atmosphere of Turkey, allowing people to breathe in the toxic fumes. In the United States, the Clean Air Act was enacted in 1970. This is a federal law that regulates air emissions from stationary and mobile sources. The goal is to regulate the emission of hazardous air pollutants. But according to the Massachusetts Institute of Technology, air pollution here in the United States can cause up to 200,000 premature deaths each year in the U.S. This is a much higher number than those found in Turkey, even though we have the Clean Air Act enacted since 1970. Access to care can be analyzed by looking at available primary and specialty care physicians in a country. So in Turkey, there are approximately 50 primary care physicians per 100,000 of the population, whereas here in the United States, there's about 91.7 active primary care physicians per 100,000 of the population. So this is a huge difference in itself, just to access your basic primary care preventative services like your family doctor. In Turkey, there's about 50.11 specialist surgical workforce per 100,000 of the population. So this includes surgeons, OBGYNs, and specialty doctors. In the United States, there's just a bit more than that, and that is 54.71 specialist surgical workforce per 100,000 of the population. Here's a chart provided by the World Bank portraying the teen birth rates per 1,000 for Turkey and the United States. As you can see, the rates of teen births are relatively similar in the two countries. In Turkey, it's about 27 per 100,000 women aged 15 to 19, and in the United States, it's this green line, and it's about 21 per 1,000 of women aged 15 to 19. There are plenty of differences and similarities between the healthcare systems in Turkey and the United States. I hope you enjoyed hearing a little bit about each one. But overall, the United States is a much higher income country than Turkey, and thus has progressed farther in certain aspects of health. Turkey is still developing, but making strides towards becoming a very successful universal healthcare system. They're much different in their systems of health coverage, but are both successful in providing care for their citizens. My name is Hannah Ammon. Thank you for listening.